about the anatomy and different things. What's the name of it? Energetic medicine.
Biofeedback philosophy.
Yeah. There's some ideas about gentle biofeedback philosophy. I want you to review that book. The next book is the one we're going to talk about, and it's called what? Operationalizing?
Yeah.
Okay. That's what I need to lecture to you about. Operationalization. You were one of the first ones I actually did a tape off with.
Yes.
And
make up stuff.
I just, yeah. You kept looking. Now, if we are dealing with symptoms, we are not diagnosing. If we, an analogy is headache is a symptom, it is head pain. Okay, it's not a disease, that's a symptom. If it was a migraine, that's a disease. That's assuming there's a reason for the headache. Just a classification of the symptom is not diagnosis. If we try to intuit a group of symptoms together, that is called a diagnosis. Diagnosis. There we go. I get it. Diagnosis. You are not licensed to diagnose yet, but you are able to take a symptom profile. This is basically what a homeopath does, and this is what a biofeedback person does. And what I'm going to ask you to do in its simplest form is to try to get a grip on getting a symptom inventory that allows you to really understand and help the patient as best you can. The first thing we need to recognize is we do not lead off with what's wrong with you. We try to set the tone for wellness and ask questions about what is good with you, what is well with you, etc. And try to understand the patient and try to hold back as a secondary process to get into what's wrong with you, never as a primary process. Understand. It's not easy. Patients are coming to you with the flat out, what's wrong with me?
What's right with you today?
It's a good idea. What's right with you? What's wrong? How are you? Because as soon as we say how are we doing, we're asking that that, what's wrong with you.
Mm-hmm.
What we're really trying to find out in the first step is, what are the good things? What's the wellness, etc. But very, very quickly, patients will then, but I'm here because I got a pain in my ass, So, as we get into understanding the symptoms, I've given you an acronym in the book. I don't know what page it's on. It's a couple pages in there.
Yeah.
Titdefend.
Titdefend, that's it.
Titdefend. Give it to me.
Type
T.
I
I.
T
T.
D
D.
A
A.
F
F.
E N D.
First is
Type.
type of problem. Tell me about the type. I have a pain. Okay. Let's talk about the pain. What kind of pain do you have? Type. Okay? Now basically when we're talking about this in medical terms, I like to tell them, describe the pain, I like to watch their body movements. I have a sharp pain. See, they're sharp. Or I have a dull ache. I have a spasmodic pain. I try to get them to show me where. This is important. And I want to try to find out more about, I'm analyzing this symptom. I'm not assuming a diagnosis. This is the basis of homeopathy, is to not assume any patterns, but to get them to fully describe what they're doing. And majorly is, once we get this down, when they come back, you will find many, many times on most of your patients that what they told you the first time was all a lie.
Mm-hmm.
They come back the next time with a whole completely different picture. And now you start to understand what's really wrong is that they're sick in the head.
So you got a little bit of biofeedback, it just tells you.
Yeah. But this is when we're trying to get to an idea. Now this is also based into a lead into the homeopathy page. Okay, the homeopathic repertory. And you got type. Next one, intensity, right? What is the intensity now? How bad is your pain? And basically, to try to break it into a number of biofeedback terms, 10 to 1, 1 to 10. 10 being high, 1 being low, or 0 being, let's do that. 0 being 0. And it's biofeedback to now say, what is what's the tension in your forehead right now? Number.
1.
It's a 1. 3. 5. Can you make it a 2?
Sure.
Can you make it a 7?
No. Yeah, I can.
That's feedback. That's a feedback loop. Simple practice. Finding out intensity, etc. This is important because write this down so we get a grip on, this, so that we can see if there's improvements or not in what we're doing. Next.
Trigger.
Triggers. What are the triggers? Where's Roy Rogers' horse? What are the triggers? What triggers you off? This is one of the most productive things that you can ever do, talk to a patient. You'll find out that for the most of the patients are sitting there because they do not understand this. And the most productive thing you can do is talk about what triggers them into this. And when they are stuck, the simple word is usually stress. Does stress trigger you? Yes, it does, but other things as well. What other things? Okay, But learning what the triggers are is one of the most productive things we can do as a healthcare practitioner to help them to understand. Next.
Duration.
What is the duration? You get headaches for a day, you get them for an hour, you get them for a minute, you get them for a second. What's the duration? Very important, so we can also get back, find out.
Alteration, evolution.
Is there an alteration? This is for, has it been evolving? Has it been getting worse? I've had a headache that's getting worse. Anything that's getting worse, always suspect that there's something growing, which could be tumor, whatever, or blockage or something, if there's something growing, you know. But alteration, is it getting better or worse? What happens to it? Next.
Frequency.
How often? Once a month with a period. I go crazy and want to kill my husband. It's his fault. This helps to tip you off into cycles. Next.
Early intervention.
What is the earliest intervention? And basically a lot of times the reason that they're sick also is because they've never thought about that. Their idea is crisis mode. What are some of the earliest interventions? If it's stress reduction. So it's sitting down, you know, relaxing.
Question you had after was what makes it better?
What makes it better? That's the key of homeopathy. What makes it better? What makes it worse? That works.
And sorry, different.
Different.
What do you want different?
Oh yeah, what do you want
If
different?
you want something different, you'll have to change.
That's our NLP question of the day. Because oftentimes you get this far in the interview and you find out, no, they don't want nothing different. They just came in because they like you. Stupid as that sounds. Sometimes it just needed somebody to talk to. And other times it's just the fact that they don't really want anything different. They just want to kind of cope a little bit better with what they have, and they really don't want to stop eating or smoking or doing anything different. And they just want to understand themselves a little better, and that's fine. Cool. But by doing this little operationalizing, we're setting up the operations so we can understand. When we do this, we must realize that this is a form of behavioral medicine. The hallmark of behavioral medicine is behaviors you reward or attend to, you get more of. Behaviors you ignore or turn away from, you'll get less of.
Like when a child falls.
When the child starts to whine, when we attend to it, we'll get more of the whine. This is the basis of behavioral medicine. It is the basis of homeopathy. It is the basis of our biofeedback work. We are not diagnosing, we are taking a symptom inventory.
So that's not diagnosing, going through all that stuff. Just asking questions.
You're trying to help them understand their life better.
Mm-hmm.
Diagnosing is not asking if you have a headache. Diagnosing is, you have a headache, I believe it's because you have.
Mm-hmm.
A symptom inventory.
Yeah, so we just record all this information.
You're
and not
recording
give
this
a reply
information
afterward, just
so that
basically.
you can feed back to the patient when they come back the next time. Okay, this was successful, this was not. This is very powerful healing. It is only diagnostic if you're going to now say, oh, it sounds like you have candida.
Mm-hmm.
If you're going to attach a disease to this, attach a diagnosis to it. If the patient does, then you want to take them away from that. That's the big thing you got to learn here also. When they say, I have candida, well, what's your problem? I have candida. Well, what's intensity? What's normal candida intensity? Get off it. Just tell me, no, don't tell me about a disease. Tell me about your body, your symptoms. What are your alarm states? What are your triggers? Where do you have pain? Where do you have itching? Tell me these simple things. That's much more valuable. But you'll find that so many of the American patients especially have bought into a disease profile. They bought into a disease. So they come in and they say, well, I have multiple sclerosis. Well, what's your actual symptoms? And they'll say, well, I'm losing my hair and my ass itches. And I'll say, well, that had nothing to do with multiple sclerosis. Yeah, but Bob has multiple sclerosis. And he said, maybe I do. And you can't believe how stupid people are, in their assumptives. But by going through this, you start to really understand. And then when you take this and look at many of the diseases and you learn more and more about medicine, you're going to find out that most of the diagnostic process done by medical doctors is inappropriate and that doesn't really hold water.
It's whether you have 4 or 16 symptoms, you're still put in that category and you're still walking out with the same drugs.
They're trying to diagnose you. We're trying to get you to understand yourself better, so that if we do something that makes you feel better, you'll be able to do more of it and capture,
Everybody has a different reason why they got there, and it's not going to be the same solution for everybody either. So.
The first part of this operationalism book is very important for you all to read. The second part, after this thing, starts into a nursing diagnosis to understand more and more symptoms. It is not important for you to read. It's important for you to have. You should skim it.
That's the blue one?
No, that's the first one. That's the,
Halfway through the yellow.
Oh,
yeah.
okay.
So somewhere around 1/4 of the way through the yellow, you're going to start slipping into a categorizing. You don't really need to see and read and memorize all that shit, but you need to understand this.
About this one.
Yeah, I think that there's a demarcation you understand. The other book is more for also general reading and to skim and to generate questions of. But as biofeedback technicians, you need to be aware of more about what's in that book, etc. And also that this is a scientific book to back you up. And then also if you have ideas about things to change in the book to make it simpler, better, whatever, I want your feedback.